Thank you so much to both of you, Philippe and Victor. We have just 3 minutes for discussion, and I will make a comment and I would like to have a short reply from both of you. First, my perception is that those cost-effectiveness studies, the outcome of those studies very much depend on who funds the study. Second, in regards to the neuromodulation, because of course both therapies have advantages and disadvantages, one of the problems that I didn't listen you to mention it is the possibility of the need of an MRI after the procedure, which is really inconvenient. In regard to botulinum toxin injection, you mentioned, Victor, that definitely ORB is a chronic condition. However, in the literature, the number of patients repeating the injection is dropping from 800 to 47 or something like that to get the fifth injection. So that means that not all patients are very happy with repeated treatment. So just a short reply from each of you, please.
Okay, well, I'll address that one question. The reason it's 47 is not because that's how many chose to get a fifth injection. That study is in the middle of the study, so there are many of those patients that are still in treatment cycles 2 and 3. They just haven't gotten there yet. So a fair assessment of that data will be in about probably 2 more years when you have the full data set. I guess I'll address a couple of things very quickly. First is that Philip said that sacral neuromodulation is a standardized technique. Well, I would argue that if you put 5 experts in a room and put a patient that needed to be reprogrammed in that room, that those 5 experts or 5 clinicians would reprogram that patient in totally different ways. So there's no well-established standardization for reprogramming, which is important. And the other thing I'll say is the one Visco article that was presented, the ABC trial, that was not in patients with refractory overactive bladder, so I would say that's not relevant to this particular discussion. That was on all comers.
I would like to react on the cost-benefits analysis. And being involved in one of these studies myself, I would compare, for the time being, cost-benefit analysis with a bikini. They cover the essential. Having said that, it is interesting information to realize that this is indeed expensive therapy, and then probably both therapies on the long term will be equally cost-effective or not effective. Nevertheless, we are confronted with a group of patients that need chronic treatment, and then the advantage of neuromodulation, if successful, is that indeed these patients, even now with a follow-up of 20 years, can be treated effectively, and that with botulinum toxin there is a guarantee that these patients will need indeed repeat treatment. So I think it is essential to realize that these therapies have advantages and disadvantages, and I cannot repeat more that in my personal opinion, having both therapies available in our center, it is indeed a discussion with the patient that for the time being will lead us and indicate what is the best therapy. I confess that we are in the favorable situation where both these therapies are fully reimbursed, so the cost is not an issue for the individual patient, and I accept that indeed in certain settings it can be the case. But nevertheless, I think in view of the availability and the safety of neuromodulation, that we should pay more attention to that, and if we are physicians treating these patients with severe symptoms of overactive bladder, that neuromodulation has a place to be.
Okay, thank you very much, both of you. You did a good job. Thank you.